I will start the opening remark. Yes.
Recording in progress.
Doctor, you can start and ask them to make an announcement to log in using secondary device.
Okay. Hello. Hi, everybody. This is Dr. Jignesh Saswala, Honorary President of Maharashtra Ophthalmological Society. I welcome you to the third MOS Clash of Titans. We have our quiz masters, Dr. Akshay Nair and Dr. Zain Khatib. And the technical support is by the Sai Numerotech. I would request Dr. Akshay Nair to explain them the rules of the quiz before we go ahead. Thank you. Thank you for joining. Over to you, Akshay.
Good evening. Thank you, sir. Right, sir. I hope I'm audible.
Yeah, very much.
Excellent. So basically,
sorry
this
to
is
interrupt. Doctor, sorry
Yes,
to
sir.
interrupt. Kindly request them to join using the secondary device through the link which we have posted on the chat box.
Right. So if you now that you've logged into the to this webinar, in the chat box, you will see that there is a link that has been posted. It says participants in the secondary device, visit, and then there is a link so that you can participate in the quiz. So unless you log in through a secondary device, which means maybe a phone, another laptop, or any other device, you will not be able to put in the answer. So you're seeing the quiz on one device, and then you will need to log in through a secondary device to be able to put in your answers. This is, these have been the rules for all our previous quizzes as well. So we'll just give a couple of more minutes before everybody has logged in through a secondary device. So then we can go ahead and start. While we wait for everybody to join in, I'm going to thank Dr. Jignesh Taswala and our committee of our quiz masters who've voluntarily taken time off to contribute interesting questions. And I'd also like to thank and welcome my co-quiz master, Dr. Zain Khatib, who's been very, very proactive in spite of having an examination this week with his questions, especially the topics that I am not so familiar with, like cataract and refractive. So I'm quickly going to jump over to some of the rules that we know So this quiz is open to all MOS members and non-members. The quiz itself has 40 questions. Once you see the question and I finish reading the question, once you see the slide with the question and I finish reading the question, a 30-second timer countdown will begin. At the end of 30 seconds, no more responses will be recorded from your device. For the answer to be recorded, you need to correct you choose the right option followed by save button, and only then your response is recorded. The assessment on the scoring is done based on not only how many correct responses but you've got, but also how soon you gave that response. Like I've said, please log in from a secondary device for sending your answers. If you see the chat box, there is a link that has been posted. That will be the link that you need to join in from a secondary device like a phone, a secondary laptop, or a tablet, so that you can send your answers from that device. We're going to announce 4 quiz winners. And remember, there may be some controversial questions. There may be a question that, for some reason, our oversight, we have overseen the answers, or one of the options could be a little dodgy or incorrect. But at the end of the day, the quiz master is always right. So forgive us if there's anything that may come up a little later, but the rules of the game have to be set. I think Mr. Sai, you want to post that link once more so we just see it again.
All the rest of the 90 participants, have they joined through this, or we are still waiting, Sai?
We are still waiting, Doctor.
Okay. Because we'll have to re-announce all the rules in case people are joining.
All right, so we'll wait for a minute before we launch, sir.
Yeah, no, we'll have to wait once you get a green signal, because Sai knows now he is admitting all the.
All right.
So he gives a green signal, we go ahead. You might have to repeat the rules because new people are joining, they won't be aware.
Absolutely, no problem. So I'm just going to stop screen share for a second and
Yes.
we'll log back in a minute. So I think as of now, we have 9 attendees as quizzers who've joined in.
Correct. Yeah, are they part here or they're still outside? That is what 90 people have actually registered.
Okay.
Friends, we are waiting for new joiners. We'll wait for about 2-3 minutes before we start the quiz. Dr. Akshay Nair is going to explain you the rules. In case you have got it right, you just give a thumbs up in the chat box. Sai, everybody can give a thumbs up in the chat box, or is there?
Yes. As of now, yes.
Any way else to get a feedback?
Can be done, Doctor.
Yeah, can be done. So just give a thumbs up that you have understood the rules, so we can go ahead with the quiz. $17.
Recording in progress.
All right, sir. It's 9:43. I think we should be able to.
Sai, do we go ahead? Any more additions? Those who have registered, can you send a quick mail to them with the participant link?
I'll show you.
Yeah. So we'll wait for another 1 or 2 minutes and then we start. What happens after we start and people join? I have put this new link in all the majority of this. We started karke. Nineteen. 21. 22.
I think we have seen one person with 2 devices there in the audience link itself. Everybody has got. I think a lot of people have joined with the same link from 2 devices. Is that right, Sai?
Let me check.
Nit Kumar has joined.
It's not Namni, doctor. It's me only.
Actually, you only. Okay. Okay.
All right, sir. I think we should start. It's
Fine.
almost 20 minutes past our time. Yeah.
Yeah, just explain the rules because about 5 people have joined new. Quickly.
All right. So the rules, like we said, are that there are 40 questions. There is a 30-second timer that begins counting down the moment we read the question. You can answer immediately the moment you see the question and the options without waiting for me to finish. The moment you see the timer counting down is when you can start answering. You please select the correct option and hit the save button so that your answer is recorded. The correct answer and the time that you take, the least time taken to send the right answer, both will be considered in the assessment. And like all the participants already have, you must log in from a secondary device for sending your answers. Remember, if there are any discrepancies or doubts or controversial questions, the quiz master is always right. With that, we'll move ahead to the first question of the quiz. Are you ready? Well, I'm assuming you guys are ready. And this is your first question. So we have the timer set, right? So when I move into the next question and finish reading the first question, we'll have our timer. Question first is, after performing a permanent punctal cautery, what is the expected rate of recanalization? A, 5 to 7%, B, 8 to 20%, C, 20 to 30%, or D, 35 to 42%. Sai, has the timer begun?
Yeah, 9 seconds, 8 seconds. It's there. I have logged in through the second device. 4 seconds left.
All right.
Time is up.
All right. So with that, the time is up. And the correct answer is 20 to 30%. So punctal cautery is a common procedure that is done for severe dry eye, for Stevens-Johnson syndromes, and even a lot of patients with blepharospasm. It basically is a procedure done to occlude the puncta permanently so that there is more fluid retention on the ocular surfaces. But many times we need to counsel patients that in almost up to a third of these cases, the puncta can open up. So you may need to cauterize them again. With that, we go to our second question. You see this device, this photograph. What is this device? Is it a Lester-Jones tube? Is it a mini monoca? Is it a master car? Or is it an express mini glaucoma shunt? So these are these are all the same devices in slightly different sizes. And you need to tell me what is the name of this device. It is a surgical, used in surgeries as an adjunct. And with that, our time is ticking down. 2, 1, go. The poll is locked. And the right answer is a Lester-Jones tube. Well, the actual name would be Lester-Jones tube with stop loss, which is basically a tube that is put in place that connects the conjunctival cul-de-sac into the nasal cavity, done as an alternative to DCR when a DCR is not feasible, such as a canalicular block or something. We can see 56% of our respondents got it right. Our next question, a caroticocavernous fistula causes all of the following except A, bruit, B, pulsatile tinnitus, C, proptosis, D, blood in Schlemm's canal. And you can lock in your answers. Caroticocavernous fistula causes all of the following except bruit, pulsatile tinnitus, proptosis, and blood in Schlemm's canal. Some of these are clinical, some of these are on examination when you need to use a gonioscope to see blood in Schlemm's canal. But all these features overlap in a lot of other conditions. With the time having elapsed, let us look at our answers. The right answer is pulsatile. 7% of the audience got it right. 53% of the people got blood in Schlemm's canal, but blood in Schlemm's canal is something that is actually seen in CCF when the pressure, when there is raised episcleral venous pressure. The next question, what is Palinopsia? A, is it abnormal persistence of a recurrence or abnormal persistence or recurrence of an image? Is it B, abnormal perception of objects vibrating? Is it C, abnormal appearance of objects larger than they are? Or is it D, abnormal perception of colors which are darker? Palinopsia, it's an unusual word that we don't often read in textbooks, but as the name suggests, opsia is more likely something to do with vision, or rather the perception of vision, whether it's vibrating, whether it's size, or whether it's colors or recurrence. With the time elapsed, let's see the right answer. The right answer is abnormal persistence or recurrence of an image long after having moved away from seeing it. And that is what is Palinopsia. 60% of the people got it right, which is great. Our next question is this. This is an image that you can see. Which of the following is not used to treat this condition? Is it A, interferon? Is it B, mitomycin C? Is it C, 5-fluorouracil? Is it D, vincristine? Your time has begun and it's counting down. As you can see, this is a diffuse slit lamp image showing a particular pathology on the surface. I think I have already given enough hints while describing, or rather not describing, this image. The diagnosis is speaking for itself. The pool is locked, closed, and let us see the right answer. The right answer is vincristine, and expectedly 75% of them have got it right. This is interferon, mitomycin C, and 5-fluorouracil can be used topically to treat ocular surface squamous neoplasia, which is being depicted in this picture. Our next question is this. Teprotumumab is an FDA-approved drug for use in A, BRVO-related macular edema, B, wet ARMD, C, thyroid eye disease, or D, non-infective intermediate uveitis. So this is a drug that in history was FDA approval in the shortest period from application to approval. Is almost like an emergency approval for commercial use. Not yet available in India though. Which of them is the indication? And time is up. The poll is locked. The right answer is thyroid eye disease, but only 50% of the audience has got it right, which means that 50% was still a little confused. Tepezza is the brand name, as you can see. Our next question is, this is a B scan of a 60-year-old male with loss of vision. What is your most likely diagnosis in this case? Is it A, RPE adenocarcinoma? Is it B, a metastatic choroidal lesion? Is it C, choroidal melanoma? Or is it D, choroidal melanoma? I think there are enough clues on the image of its appearance in terms of its characteristics, the shape, the size, the location. And I'm fairly certain a lot of people here in the audience would have pounced on this even before the timer would have started. And the poll is locked, the voting is closed, and I expect 100% of the audience to have got this right, but no, we have 89% of the audience who got it right. This is a choroidal melanoma. As you can see, it has got a collar. If you look at the A-scan reading at the bottom, you can see internal acoustic hollowing. Gradually, the graph reduces in amplitude. It's got a mushroom shape as it breaks through the Brooks membrane. All right, our next question is this. A 22-year-old patient sends these photos saying he was worried about the spot in his eye. What is your likely diagnosis? Is it a sentinel vessel from an intraocular tumor? Is it B, conjunctival nevus? Is it C, scleral nerve segment? Or is it D, an old retained foreign body? Your time has started with 15 seconds to go. This is actually something that we may all have seen under the slit lamp while examining patients, but it's just that we may never have scratched our heads and figured or wondered what it actually was. Well, let's see what the actual answer is. The right answer is they are scleral nerve segments. They're also called Axenfeld nerve segments, which are seen as these pigmented dots that break through the sclera, and they always usually have an accompanying vessel. For a change, the majority of the answers were conjunctival nevus, which is incorrect. Next question is this. This OCT finding is associated with which? Is A, choroidal metastasis? Is it B, gross hypotony? Is it C, neuroretinitis? Or is it D, posterior scleritis? As you can see, the OCT as well as the red-free image are from the same page as the raster, the direction or the plane of image acquisition. It's obviously a very distorted image, but what could have caused this? Your time is, answer is gross hypotony, which 55% of the audience has got correct. Our next question, or question number, do we have the right question? Question number 10, that's right, is which beverage should come to mind when you see this CT scan image? Is it A, Red Bull? Is it B, cappuccino? Is it C, iced tea? Or is it D, Coca-Cola? The time is ticking. I know this is an out-of-the-box question, but it's something that most trainees and practicing ophthalmologists should know about. What beverage does it remind you of? Let's see if majority of them get this googly. Your time is over, and the right answer is Coca-Cola. You can see that this is a Coca-Cola bottle sign where the tendon sparing thickening of the extraocular muscle. This axial image, you can see that the muscle resembles the shape of the old generation glass bottles of Coca-Cola. And that's why it's called a Coca-Cola sign. Bravo, 68% of the audience got this right. Question number 11 is, which is the most important predictor for recurrence and survival in patients with cutaneous melanoma of the eyelid? Is it A, excision margins being free of tumor? Is it B, the diameter of the tumor? Is it C, proximity to the eye margin? Or is it D, tumor thickness? Which of these four factors has the maximum weightage or bears maximum bearing in terms of recurrence and survival when you are seeing an operating patient with a melanoma of the lid? Your time is up, and the right answer is tumor thickness. And majority of the audience has said excision margins being free of tumor. Even if it is not free of tumor, it can recur, but metastasis occurs is directly associated with tumor thickness, and therefore survival is not dictated by the margin free, the free margins of the tumor, but rather by thickness of the tumor. Our next question is, which is the more appropriate investigation of this patient? Is it CD4 counts? Is it RT-PCR for COVID-19? Is it C, serum cholesterol? Or is it D, blood pressure measurement in view of the fundus findings? Now, this is a very classical fundus picture that is seen in the condition that is associated with. It's got a name, which is something that is associated with. Go ahead and say it's a food item. Your time is up, and 65% of the audience has got it right. It is CD4 count. So the disease entity that we're talking about is CMV retinitis, which gives us a pizza pie appearance. Not quite an appetizing pizza, this one, but you're right. In CMV retinitis, you would want to rule immunosuppression, and therefore HIV and CD4 counts would be standard management. This is your next question. Karl Kohler in Austria in 1884 used a chemical compound for anesthesia in an eye surgery. Which chemical did he use? Is it A, cocaine? Is it B, halothane? Is it C, ether? Or is it D, chloroform? Anesthesia was not a known thing, was not a commonly practiced thing, and the only thing that people knew were inhalational and not intravenous. But for specifically for topical ocular anesthesia and for anesthesia in general, so that patients don't perceive pain, the drug that was given was cocaine, which 87% of the audience has got it right. And at one point in time, Karl Kohler, because of his use of cocaine, which he prescribed widely, was also given the nickname of Coca-Cola because of cocaine use that he had. He died very early. The question is this: bitemporal hemianopia may be seen in A, tilted disc, B, bilateral ischemic optic neuropathy, C, dermatochalasis, or D, sectoral retinitis pigmentosa. Your time starts now. It's almost 15 seconds up. This is a fairly straightforward question. There's one right answer. You need to choose that, and your time is up. The poll is closed. The right answer is bilateral ischemic optic neuropathy. In that condition, you typically see an altitudinal field effect and not bitemporal hemianopia. I thought dermatochalasis here was a googly, but you can imagine in severe dermatochalasis, the temporal visual fields would get occluded. Question number 15 is this: who is credited with inventing the binocular indirect telescope? Is it A, Donald Gass? Is it B, Alvar Gullstrand? Is it C, Gustav Hein? Or is it D, Charles Schepens? All of these names are very familiar names for us. We've read about them in history. It sometimes can be difficult to place the name with their achievement or with what they've been credited with. In this case, we're looking for the inventor of the indirect ophthalmoscope, a device we use every day. The right answer is, of course, Charles Schepens. Donald Gass is known as the father of modern vitreoretinal, given that he's written an atlas and also gave the classification of macular holes. Alvar Gullstrand invented the slit lamp, and Gustav Hein is a name I just came up with because there's a Hein indirect ophthalmoscope here. Your next question: the child presents with paralytic strabismus following an immunization. The nerve that is most likely to be involved would be A, 6th nerve, B, 3rd nerve, C, 7th nerve, D, both A and B are equally likely to be affected, which means the 6th and the 3rd nerve may be affected. You have one answer that you need to choose. We have 10 seconds to go before the voting is closed. What is your right answer? Enter it and save it. And time is up. The right answer is the 6th cranial nerve, and majority of the audience, 60% nearly, got it right. Question number 17 is this. Now look at this picture. This is a motility picture of a 58-year-old female with sudden onset diplopia. Where is the likely lesion supposed to be? Is it left MLF? Is it right MLF? Is it left PRF? You're already begun. In case you're wondering What is PPRF? It's the paramedian pontine reticular formation. And I think time is up. The right answer is the left MLF. All right. So question number 18 is this. This is a slit lamp image at low magnification and at high magnification. Which of these following conditions is not associated with this clinical finding that you see in this image? Is it A, keratoconus? Is it B, acanthamoeba? Is it C, Fuchs dystrophy? Or is it D, limbal stem cell deficiency or LSCD? Remember, this is a not, which means which of the important thing that to focus on is which of these conditions is not associated with this clinical finding. One of these four does not show you this clinical feature when examined under this slit lamp. Your time is, the right answer is LSCD, limbal stem cell deficiency. The majority of it right. What we are seeing are enlarged corneal nerves, which is obviously seen in keratoconus and in some cases of Fuchs. Also in acanthamoeba perineuritis, we can see these thickened corneal nerves. Question number 19. The most common site for the optic nerve injury in cases of traumatic optic neuropathy is A, the intraocular segment, B, the intracanalicular segment, C, the intracranial segment, or D, the intraorbital segment. These are four segments of the optic nerve. Always had a tough time in figuring out which part was called what, but I think finally this question may have explained it to me. Are we talking about the intraocular, the intracanalicular, the intracranial, or the intraorbital? Which part of the optic nerve is most susceptible for optic nerve injury in trauma? The intracanalicular segment, because surrounding this is where the annulus of Zinn is firmly adherent, and there any trauma that occurs in or surrounding the orbit, the compression waves get focused right down to this area or this segment of the bone, and then it is transmitted to the nerve that is within the canal. Your question number 20th is, what percentage of the population have a cilioretinal artery present? Your answers are A, 33%, B, 44%, C, 16%, or D, 25%. Choose the right answer and hit the send button. This image, of course, is a demonstrative or a representative image of a patient with a cilioretinal artery occlusion. Your time has almost ended. The right answer here, of course, is 25%. Let's see how many of you all got it right. 22% only got it right. All right. So with that, now I hand over the reins to my co-quiz master, Dr. Zen. Please take over.
Thank you, Dr. Akshay. Thank you, Jignesh sir and the entire MOS committee for inviting me, and Dr. Akshay for hosting it so well. So I'll be taking it forward from here on for the latter half of the questions. So without wasting much time, let us go to question number 21. So which of these drugs is most likely to cause an optic neuropathy? So is it A, chloroquine? Is it B, ethambutol? Is it C, thioridazine? Or is it D, vigabatrin? So you have 20 seconds left on the clock. We've all heard of these drugs, all used for different purposes. Pretty straightforward question, and I'm sure most of the audience would get this right. And with that, our time is up. And the correct answer for this question is ethambutol. And I think the maximum audience has marked ethambutol 96%. Pretty straightforward. Let's move on to question 22. Okay, so question number 22 is, what is the duration of action of topical proparacaine drug? So your options are, is it A, 20 minutes? Is it B, 12 minutes? Is it C, 25 minutes? Or is it D, 7 minutes? So we all use this drug. Let us see how many of us know what exactly is the duration of action of this. We have 5 seconds left. Right, and the poll is locked. The correct answer for this question is 20 minutes. And unfortunately, most people have marked that wrong. Only 26% have got it right. So hopefully now we know. Let's move ahead.
So now you need to finish the topical FICO in under 12 minutes. That means.
True. Yeah. Okay. So question number 23. All the following features are seen in association with neurofibromatosis type 1, except A, cafe au lait spots, B, eighth nerve tumor, C is Lish nodules, and D is optic nerve glioma. So which of these features are not seen with neurofibromatosis 1? So we all know there are two types of neurofibromatosis, type 1 and type 2. Which of these features is not seen in type 1 NF? And the poll is locked. The correct answer is eighth nerve or vestibulocochlear nerve tumor. And most of the audience, fortunately, has marked that right. Let's move ahead. Okay. So another simple question. In asteroid halosis, the vitreous particles are made up of what material? So is it hyaline material? Is it cholesterol? Is it keratin? Or is it calcium? Asteroid halosis, something that is seen quite commonly in the OPD. What are these yellow particles made up of? So I think the questions have all been quite simple. Okay, so the poll is locked. The correct answer is calcium, and most of the audience has got that right as well. Moving on. Okay. So the photo that you see here, what is this object better known as? Okay, so your options are A, Malyugin ring, B is B-hex ring, C is Grishaber expander, and D is APX dilator. So I'm sure you all would know that we are talking about some form of a pupil expander during cataract surgery. We have to identify which particular one is this. So someone who's been doing cataract surgery would know the answer to this question. And the time is up. The correct answer is Malyugin ring. 69% have got it right. So Malyugin ring, invented by Dr. Boris Malyugin from Russia, very commonly used device during pupil expansion surgery. B-hex ring being something invented by Dr. Suvin Bhattacharjee from India itself, also another very popular product used for pupil expansion. So let us move ahead. Question number 26. Okay, I would want the timer for this question to be started after I finish the options, since the options are long. What of the following statements about aberrations is true? A is myopia, hypermetropia, and astigmatism all are first order aberrations. B option is Zernicke's polynomials are not the only way to express ocular higher order aberrations. C option is the normal young crystalline lens has positive spherical aberration. And D, spherical aberration is the most common aberration seen in a decentered ablation zone. So you have to say which of these statements is true. And the timer has started. So we are talking about ocular aberrations here. please go through the options properly before marking.
One more option. I have no idea. These are the kind of questions that are so tricky.
Okay, the time up. Yeah, the correct answer is B. And yeah, so most of the audience, majority of the audience have got it right. It's not actually tricky. So Zernike polynomials are not the only way to express aberrations. There's another way called Fourier analysis, which also expresses aberrations. Let us move
So at least
ahead.
from my answer, you know that now I don't do refractive surgery at all.
Again, let us start the options after let us start the timer after I've read the options. Which of the following statements about accommodation of the lens is true? So A, the amplitude of accommodation starts decreasing after 40 years of age. B, the depth of field and depth of focus are influenced by accommodation. C, myopes tend to accommodate more than hypermetropes. And D, in hypermetropes, the far point of accommodation is virtual, whereas in myopes, the far point of accommodation is real. Again, to mark the true statement of the four. This is from basic sciences, something that should be known about accommodation of the lens. We have 15 seconds on the clock. So the time is up and the poll is locked. The correct answer for this is in hypermetropes, the far point is virtual, and in myopes, the far point of accommodation is real. Unfortunately, only 14 people marked it right. So most of the audience has marked answer A. Well, the amplitude of accommodation doesn't start decreasing after 40 years of age. The amplitude starts decreasing from childhood, but becomes significantly lesser after 40 years of age, so that it starts manifesting as presbyopia. Okay, so that is probably, you can say, a trick question. It starts from much younger. Right, so let's move ahead. Question number 28, which of the following statements about mechanism of action of different anti-glaucoma medications is false? So you have to mark the false statement. A, pilocarpine, it acts by increasing the aqueous outflow by contracting ciliary muscles attached to the scleral spur, leading to dilatation of the Schlemm's canal. Option B is on timolol, which reduces the aqueous production by inhibiting beta-2 receptors on ciliary epithelium. Brimonidine, it reduces the aqueous production by stimulating alpha-2 receptors in the precapillary arterioles of ciliary vessels, causing vasoconstriction. Option D is latanoprost, increases aqueous outflow through the uveoscleral route by causing extracellular matrix remodeling in the ciliary body. So we have 30 seconds. You can mark your answers. You have to mark which of these anti-glaucoma medication mechanism of actions is not correct from the four options. Again, this is regarding basic sciences. So this is something that, as residents, we should know before we actually understand about which medicines to give, which not to give. We need to know the mechanism of action. The poll is locked. The correct answer to this question is C, brimonidine. And 26% people have got this right. So brimonidine actually reduces the aqueous production by stimulating alpha receptors, not in the precapillary arterioles, but rather in the ciliary epithelium itself. The receptors which are present in precapillary arterioles are alpha-1 receptors, and brimonidine is a alpha-2 agonist. So that was the wrong mechanism. All the other mechanisms are correct. Moving on to the next question. Okay, after undergoing uneventful cataract surgery, a patient is found to have a refractive surprise of -3 diopters post-operatively. Which of these could be the most likely reason to have caused this error? A. Inadvertent pressing on the cornea while performing contact A-scan biometry. B. Having a history of previous myopic LASIK that was not known at the time of surgery. C. Having a silicone oil-filled eye that had not been accounted for while performing biometry. Or D. The use of SRK1 formula for IOL power calculation. And the timer starts now. So which of these could most likely have caused a myopic refractive surprise in this patient? Ten seconds left on the clock. Please read the options carefully before answering. We have 30 seconds and the poll is locked. The correct answer to this question is A, inadvertent pressing on the cornea. And of course, most people have got it right. All the other three options would lead to a hyperopic correction, whereas pressing on the cornea, something which is done quite commonly when contact biometry, it leads to a myopic refractive surprise and not a hyperopic. Okay. So moving on to question 30. So a 70-year-old man underwent cataract extraction with phaco and insertion of a PCIOL. The first day post-op, he comes back with severe stromal edema and moderate epithelial edema. Which of these would least likely cause for causing this? So is it A, TAS, which is toxic anterior segment syndrome? Is it B, elevated IOP? Is it C, excessive use of phaco energy? Or is it D, surgical trauma to the endothelium? Can start the timer. So we are talking about a complication following phacoemulsification, where the patient on the first postoperative day has severe stromal edema and moderate epithelial edema. The answer to this question lies in this particular part. Which of these is the least likely cause for the above? 5 seconds remaining. And the poll is locked. The correct answer for this is elevated IOP. Again, only 11% people have got this right. So the logic for this is whenever there is elevated IOP, there will never be severe stromal edema with moderate epithelial edema, but rather there will be much more epithelial edema, which is caused because of raised IOP, and the stromal edema will be minimal or zero. All the other causes, that is TAS or phaco or surgical trauma to the endothelium, will always lead to stromal edema. And if the stromal edema is severe, would cause some amount of epithelial edema. So that is why the answer is elevated IOP. Let's go ahead. What is true about Schirmer's test that is performed after anesthesia? A, it measures the reflex tear secretion. B, it measures the basal tear secretion. C, it should be used with at least 4 drops of topical anesthetic. Or D, it should be performed before drying the cul-de-sac. So Schirmer's test is something which is done very commonly for dry eye syndrome. We are talking about doing Schirmer's test with anesthesia. Which of the statements is true? So Schirmer's test with anesthesia is the Schirmer's 2 test, whereas the Schirmer's test without anesthesia is Schirmer's 1. The poll is locked. The correct answer to this question is it measures the basal tear secretion, and 83% have marked this right. So that's good. People know about Schirmer's test. Let's move on. So you use Duochrome test to refine a patient's refraction. A patient says that red letters appear more clear than green letters. So in this case, is the patient over plus? Is the patient over minus? Is the patient anisometropic, or is the patient astigmatic? So if the patient says red letters are more clear than green, in what state is the patient? Over plus, over minus, anisometropic, or astigmatic? We have 15 seconds left. Duochrome test is one of the tests done to refine the refraction after we have done the primary correction. I'm expecting people should get this answer right. The poll is locked. The correct answer is overplus. And we have a tie between overplus and over minus, so 50-50. So whenever red letters are clearer than green letters, the eye is always in a state of relaxed accommodation. So the patient would never be over minus. The patient would either be under minus or over plus. So that is about the duochrome test. Let's move ahead to question 33. What is the most suitable treatment for stage 1 diffuse lamellar keratitis, or DLK? Topical steroids, lifting the flap and irrigating under, mitomycin C, or doing a PTK? So yeah, the timer has started. What is the most suitable treatment for stage 1 DLK? The photo is showing DLK, but it's not stage 1. It's probably stage 2 or 3. Don't look at the photo. Look at the question. What is the most suitable treatment for stage 1 DLK? Okay, I think I've given a big enough hint here. We have 5 seconds left on the clock. The poll is locked. The correct answer is topical steroids. Almost 90% have got it right. Pretty straightforward. Let's move ahead to question number 34. Again, another straightforward question. Which IOL calculation formula is most accurate for short eyes among these four? Is it SRKT? Is it Hoffer Q? Is it Holiday? Or is it the Binghorst formula? So IOL power calculation, we know that there have been various generation of IOL formulae. Some of them work well for longer eyes. Some of them will work for shorter eyes. Some of them work well for all eyes. So among these four, which one is the most accurate for short eyes? The poll is locked. The correct answer is Hoffer Q. Again, a lot of people have got that right, 70%. The newer generation formulae, be it Barrett, be it Hill, RBF, going on version 3 right now, these all have proven to be superior to Hoffer Q even for shorter eyes. But yes, among these four, among the fourth generation formulae, Hoffer Q was considered superior for shorter eyes. Okay, moving on, question number 35. Your patient is taking oral medications for symptomatic benign prostatic hyperplasia. Which of the following is least effective in dilating the pupil? Is it intraocular epinephrine? Is it iris hooks? Is it Helon 5? Or is it manual iris stretching? So we all know that taking medicines for BHP, you take an alpha blocker, which affects the alpha receptors present on the dilator pupillae muscle. One of the following maneuvers would not be effective in dilating such a pupil. We have 10 seconds on the clock. And the time is up. Poll is locked. The correct answer would be manual iris stretching. And most of the audience has marked intraocular epinephrine. Well, the thing is, whenever you have a person taking an alpha blocker, the patient will have a floppy iris, and doing manual iris stretching for a floppy iris is just going to make the pupil smaller. So remember, never do manual iris stretching for a floppy iris. Manual iris stretching can be done for other cases of small pupil, but not for a IFIS or a floppy iris. Moving on to the next question. The pathology in phacolytic glaucoma is blockage of the trabecular meshwork by A, lens material, B, erythrocytes, C, lymphocytes, and D, macrophages. So your time starts now. Lens-induced glaucoma can be either phacolytic or phacomorphic. Phacomorphic glaucoma happens in an intumescent cataract, whereas phacolytic in a hypermature cataract. One of these materials blocks the trabecular meshwork, which causes the raised IOP. 5 seconds left. Time up. The correct answer is macrophages. 52% have got it right. So the macrophages are large in size and they block the openings of the trabecular meshwork, leading to raised IOP. Moving on. Question number 37. The steroid that is least likely to cause a posterior subcapsular cataract is loteprednol, triamcinolone, dexamethasone, and prednisolone. Please start the timer. So which of these steroids is least likely to cause a posterior subcapsular cataract? Again, this is quite simple. I think most of the audience should get it right. We have 15 seconds left. Three, two, one, and the poll is locked. The correct answer for this is loteprednol. 93% have got it right, as expected. Let's move ahead. We have the last 3 questions. Question number 38. So you can see the adjacent photo. You can see yellow color mass. What is the likely diagnosis? Is it a giant drusen? Is it a retinal capillary hemangioma? Is it a retinal astrocytoma? Or is it a Hollenhorst plaque? So it's again looks pretty straightforward. Please note the position of this mass with respect to the retinal vasculature. And the time is up. The correct answer is retinal astrocytoma. 61% have marked it right. Pretty straightforward, associated with tuberous sclerosis. Moving to question 39. Which of the following drugs does not cause uveitis? Is it rifabutin? Is it cidofovir? Is it amiodarone? Or is it latanoprost? Please start the timer. Which of the following drugs does not cause uveitis? Rifabutin, cidofovir, amiodarone, and latanoprost. All these medicines, again, are not used for the same disease, used for different conditions. One of them does not cause uveitis. 5 seconds left on the clock. And that's the time up. The correct answer for this is amiodarone. 74% have got it right. Amiodarone doesn't cause uveitis, it causes cataract. And the last question for MOS quiz round 3. You are suturing a lid tear at night. Which of the following needles would you prefer for your lid tear repair? Would it be a spatulated needle? Would it be a reverse cutting needle? Would it be a round body needle? Or would it be a tapered needle? I hope the audience knows that there are different kinds of needles used for suturing. So for a lid tear at night, which needle would be most suitable? 3, 2, 1. Poll locked. The correct answer to this would be reverse cutting. 50% have got it right. And Dr. Akshay can elaborate on why a reverse cutting needle would be good for lid tear repair.
Yeah, well, it's the answer is not that reverse cutting is preferred in a lid tear at night. Even in daytime, if you're suturing a lid tear, you should choose a reverse cutting needle because it gives you a precision of entering and exiting. And unless you're suturing the tarsus, you can use a reverse cutting or a cutting needle. When you're
Right.
suturing the tarsus, you should not use a reverse cutting or a cutting because it may go through and through the tarsus. For the tarsus, you can use a spatulated point needle, but for cutting or reverse cutting.
So yes, that completes our 40 questions.
All right. So can we have the scores, please? I think we'll discard the. Sai, can you share the scores? I'll stop sharing my screen.
We have the names, I think.
Yeah,
I
The
I
scores
think
are there on the
you
screen.
can.
we can see
Yeah.
on the
So
Mobile.
right. So on the group in fourth place is Dr. Sumit Lahane, who's got 27 out of 40 right. In third place is Dr. Muskan Bansal, who's got 28 out of 40 right. And in second place is Dr. Niranjan Karthik Senthil Kumar with a score of 291, which is 29 out of 40 right in 6 minutes 22 seconds. And Dr. Kaushik Tripathi is the winner of this edition with 283, a score of 283, which is 30 out of 40 questions right in a cumulative time of 6 minutes 50. No, that was my second device, which I had to watch the timer on. No. So as we had announced, the four winners for this are Dr. Sumit Lahani in fourth, Dr. Muskan Bansal in third, Dr. Niranjan Karthik Senthil Kumar in second, and Dr. Kaushik Tripathi in first place.
Yeah, just a request to all of them. Hearty congratulations to all the winners. I would like to say that if you are not an MOS member, you have to become an MOS member to claim the prize. Well, for playing, it was fine. Now that you have got Kaushik Tripathi, in case you are not an MOS member, please contact Dr. Rajesh Joshi. We'll be displaying the number on the chat box. And please contact him for the further becoming an MOS member. Okay.
Doctor,
So
can I
thank you very
promote them?
much.
Can I promote them to Zoom so that you can talk to them?
Yeah. All of them, all four.
And then they can share their
Sumit
video.
is of course an MOS member. Sumit Lane, I already know.
Congratulations to all the winners.
Yeah, absolute big congratulations. Very difficult questions. Even I had participated. I have stood way behind. But I was just trying to see the timer and all. So half my thing was this. ASGI Hospitals. Who is this? Kaushik.
Yes, sir.
So welcome all of you. Kaushik Tripathi, you are the winner. Niranjan Karthik is second. Muskan is third. And Dr. Sumit Lane is fourth. So those who are not the MOS members, we display the number of Dr. Rajesh Joshi. Please contact and become an MOS member to claim the prize. And thanks for participating in a big way. You should be getting it from the micro people. Once you have your numbers, we already have your cell numbers. The microvision people will contact you and then distribute the prizes accordingly what we have decided. So thanks a lot, each one of you who have participated, Dr. Muskan, Dr. Niranjan Karthik, and you have Dr. Kaushik Tripathi, and of course Sumit. So let's sign off saying that you will be distributed the prizes within this month once you become the MOS member. For those who are not, rest will automatically get it. Yeah, top 4 will get the prizes. 4 prizes are there. We won't be disclosing the prizes. You will be getting a surprise gift there itself at your place in your clinic. So thanks Dr. Akshay Nair and Dr. Zain Khatib for conducting a very fantastic quiz. Your question answers were all mix and match and very nicely put up. Various, all the specialties of ophthalmology have tried to cover right from the basic to the oculoplasty. Everything was well covered.
Thank you,
Dr.
Thank you.
Sumit, he is very much there. He has already been conducting the quiz. The last quiz was conducted by him and Rohit. What do you say about this this quiz? Where Akshay and Zain has taken efforts to do it.
The questions are very nice, covering both the specialty of cornea refractive and oculoplasty oncology. And it covered everything from basic to advanced. So it was very much fun to attend the quiz and being a panelist on this side, sir. Thank you to you and Akshay sir and Zain for a wonderful quiz.
Fine.
But
I think
now past quiz masters should not be allowed to participate. Huh? So
let it be. Yeah, everybody should get a prize. No
We
problem.
also
Let them
want
compete. You see, here we have been neutral. We have not disclosed the questions to anybody except you and Zain and Sai. Even my secretary, Dr. Rajesh Joshi, is not aware of it. We are absolutely neutral. So anybody and everybody is open. It's a pan-India quiz. Only thing I think we are not able to market it the way it should be. How to go get into it, what is the exact procedure, the technicalities, I think we'll sort it out. We are learning fast.
Right.
So
Technically, it's pretty straightforward
Akshay.
actually.
No, sir. I said thank you so much for the opportunity, and thank you, Zain, for timely help.
Thank you, sir, for including.
And Akshay was all alone. I think we had another person, Omkar, telling he had some personal problems. So Zain, in spite of walking in late, he has helped Akshay to see that the quiz goes on very smoothly. Thanks both of you for an active participation and also running as a quiz masters. And Sai for a very smooth what we say, technical support for the quiz. Hopefully, I think everything is the teething problems have been worked out at this time.
Yes.
Next, I think we'll have more of audience also to participate, right?
Yes, sir.
So thanks a lot. I think we'll log off. I think rest of them will just join, see that you become the MOS member. Can each one of you tell me, are you, see, Sumit is already, Muskan, Niranjan, and the first one is Kaushik. All
Niranjan
three of you are MOS members?
Niranjan has become MOS member.
Who?
I am not a member, sir. I'll become a member.
Acha, last time, I think you only messaged, no? You wanted to become member?
Yes, sir. Yes, sir.
Yeah.
Niranjan is there and Kaushik. So we are adding 2 more MOS members. Muskan, what about you? You are already an MOS member?
No, sir. I am not the member right now.
So nice to have into our MOS membership. We'll be inviting you for becoming a member, for claiming the prize. It will be nice because a lot of more activities other than quiz we are holding throughout the year.
Okay.
As you are aware about the MOS initiatives, 21 committees, and lots of new things are coming up. The indemnity scheme, if you are aware, the professional indemnity, nowhere in India the premiums are so low, and it's a very good coverage. So that is one of the points which I just like to highlight. And Dr. Rajesh Joshi will share all the benefits of becoming an MOS member. So do become an MOS member, all 3 of you. So you'll be eligible for the prizes then, right?
Okay. Yes, sir.
I hope you don't mind joining MOS.
Yes, sir. I'll be joining.
All 3 of you. So
Yes, sir.
Thanks once again. I think we sign off. We finished right in time. And the next quiz, I'll be disclosing the dates very soon to all the members. Thanks, Zen. Thanks, Akshay. Thanks, Sai. And all the participants who have won. And Dr. Rajesh Joshi. Any queries, if you have, please let us know.
Thank you, sir.
Thank you. Sai, you stay.
I'm here.
Everybody log off. You, me, and Rajesh.
I'm here.
Yeah. Niranjan is logging off. So in the meantime, I think Akshay and all have logged off. Rest of them have logged off, except 3 of us. There are 3 of Pneumorattack. You have signed from 3 places, huh? Sai?
Yeah. Myself and my office also.
Okay. Now tell me how did it run this time? Any issues you had this time?
No technical issues as such.
But how many were the participants? Because very less, hardly any 20 also. Out of that, me and Akshay were there already.